Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Roddy Raban, and today we're going to be talking the A to Z of fillers. Everything you need to know about fillers. I've spoken about fillers a number of times, but I've always talked about it in concert with other things, and so I've never had a chance to sort of really dig deep. And I want to make sure that the listeners get a good understanding of at least my philosophy about fillers, the things you need to know, how to stay out of trouble, etc. And I'm very lucky that I have, again, a very special patient of mine, but now a dear friend of mine, Michelle, who's going to join us, because for a doctor to talk about a subject matter in a vacuum, it's one thing, but to be able to communicate and bounce ideas off of somebody who has experienced it, who can speak about it firsthand, is another. And to have you be able to come on and talk about it is awesome. And I really appreciate it, because through our dialogue, I hope that people will stay out of trouble and, more importantly, have a great outcome. So welcome to the show.
Thank you.
So I think it's important to talk about how, obviously nobody knows who you are, but just give me a rough idea. What's your age?
Well, I can't disclose that. So Roddy, don't make me disclose that on, in public record, really.
Yeah. So what happens, the reason why I'm asking is because fillers is something that often is age related. Has to do with facial volume, etc. But the point being is that when we met, you had never done any of this before. And so there are two types of patients out there listening. Those that do it all the time and frankly, just to be honest with you, think they're experts. And in my opinion, many of them don't look so good. And those that are afraid to do it because they know the people who are doing it often and look terrible and think they look so good. And so I think speaking to somebody who was a virgin to the idea, and in many ways when we met was actually opposed to it, is really useful. So we met because you came in to just try a little bit of Botox, the gateway drug. And at the time you had just inquired a little about like, hey, I've heard about these fillers. What the hell are they? Am I a good candidate? And then what you and I talked about was you said that I'm on a fitness journey and I'm getting myself in shape. And so what did I tell you?
You told me get down to the weight that you're most comfortable with your body that you can stay at. Don't yo-yo up and down and then get it. Just wait until you're consistently at the weight you want to be, and then come talk to you, because when I lose weight, I lose it in my face. So it wouldn't, get down to where I could plateau, which I have for several years. And that was really good advice.
So let's just generally speak about what are fillers. Fillers fill in volume. So often Botox and fillers are used interchangeably, but it's like getting a haircut and dyeing your hair. The only thing that's in common to them is that they're with the hair. So Botox is a neurotoxin. It paralyzes muscle. Filler is a volume replacement entity. Filler is a general term for a boatload of volume replacement entities. It can be temporary, semi-permanent, permanent, fat, out of a box, etc. But the idea is there is a hollow and you fill it, and that's the treatment for it. Fillers, unfortunately, with all of the progress we've made in the spa world, which I hate, have had a lot of issues because they're being overused by under-skilled individuals. So as a result, the people who want to dabble in it and are afraid are freaking out because they're like, I don't want to look like that lady. I want to look like a Catwoman, etc. So the purpose of the filler is to fill in volume. And when you lose weight, most people, some more than others, lose volume in their face. And you were one of those individuals. It was obvious to me. You have a very slender face, very muscular in that regard, and chiseled. And some people think filler is adding volume to make you cheeky and fat, and it couldn't be furthest from the truth. So we fill in volume. So the first thing we need to talk about when we talk about volume replacement is what kind of volume replacement, which filler? There is literally 1 billion fillers.
Oh my God.
And I mean, you wouldn't even know one from the other. Every day they're designing a new one. Every week there's something new that has some special name that some new celebrity is promoting. I literally, in 15 years, used 2 fillers. I use Restylane and Perlane, which now they call Restylane Lift. The reason I use those 2 products is 2 reasons. One, because I can do anything and everything I want to do with those 2 fillers. And 2, I don't have any issues and or complications. I do not need to use the newest, latest, hottest product because there's a learning curve. There are issues, and I have mastered using chopsticks to eat.
Yes.
I don't care that you can eat with a fork. I don't care you can eat with a spoon. I know how to use my chopsticks, so there's nothing wrong with my chopsticks. The idea is that every filler that comes out is better than the last, and that's so not true. It's just marketing because people love the hottest, newest item. So that's the first thing. Second thing is I love to use only fillers that are reversible. Why the hell would that be? Well, because you want to make money, of course. You want it to reverse. Farthest from the truth. The reason I want to use things that are reversible is for a number of reasons. Number one, what if you hate it?
That's what you told me.
What do you mean, what if I hate it? Well, what if you hate it? What if you don't like it? What if it was done incorrectly? What if whatever? Do you think you and I want to be married forever? No. So we want a product that's going to go away because we want to make sure you like it. Secondly, are you going to stay and look the same forever? No. So if you get filler that's permanent and your face starts to evolve, and that permanent filler is not evolving with you because it's permanent, you're going to have an issue. Third, what if there's a complication? I want to be able to reverse it. Now that's a big difference than absorbable versus reversible. Absorbable means it's going to go away on its own. Your body will absorb it. Reversible means I go in a refrigerator, take out a product, it's called Vitrace, I inject it, and the product disappears in 24 to 48 hours. I mean, that's like unbelievable.
Wow.
So I tend to like those products, and the overwhelming majority of them are what's called HA, hyaluronic acid based. Juvederm, Bolaterra, Sculptra, blah, blah, blah. I don't really personally like to use any other product, not because I'm not even get into if they're good or bad. There's just no reason for it. These products that are the safest profile, do everything you need them to do. So getting into materials that can't be reversed. If I had an option between injecting you with something that's reversible and something that's not reversible, but they both go away, why the hell would I use something that's not reversible?
Right.
So that's as far as the type of fillers. I stay away from semi-permanent or permanent fillers. People like them. I'm not going to get into it. I think you're asking for trouble. And their body doesn't like permanent shit because when it gets in there, you get reactions and you make granulomas and lumps. The permanent filler that people come to me literally on a monthly basis from around the world is liquid silicone, which was so popular in other countries that it got injected in lips. I do tons of lip reductions, cutting out the lip because you can't get rid of the silicone and the body keeps making reactions. So overall, you want to stay, in my humble opinion, away from crap that's permanent for so many reasons. Okay, so how long is this filler? Let's just stick with the filler that I like, which is HA-based products. Why I like Restylane? Because I like its predictability. There's nothing magical. I don't get paid by Restylane. I have no royalties. It doesn't make any difference. But I like, for example, Juvederm to me swells up too much. So you put it in and then you look like a duck. I don't really like that. It doesn't really matter. But the point being is I like the products. And then the question is, how long should it last? I've injected it. How long should it last? So the answer is, it depends. It depends on where you inject it, what kind of material you use, and what type of your body's reaction. So tell me, we've injected, let's say for you, your jawline, your cheeks, etc. Do they absorb all at the same rate? Have they absorbed over time at the same rate? Or have you noticed some places last longer than others?
I mean, it's been pretty even for me, but a little bit. I mean, you know, my animation features, I think, naturally come out. I look the same, fortunately, because you're an artist and a genius and a sculptor and you care so much about your clients that I look the same as I did when I was younger. It just, you know, it kind of naturally works itself through your normal facial features. I mean, I don't notice much of a difference.
Okay, well, that's what we want, right? But what happens is, so let's take a look. If I inject you, let's say I inject you in the nose, that filler could potentially last 1 to 2 years.
Okay.
If I inject you with the same filler in the same person, but in your lips, it may last 3 months. Lips have a much higher turnover than your nose. If I inject you with a Restylane, it may last 6 months. But if I inject you with a Perlane, which is a thicker substance, more cross-linked, it may last 9 months. If I inject you and your sister with the same product in the same place, she may chew through it 3 times faster than you do because she's just a high metabolism person.
Yeah.
So the question that everyone keeps asking is how long does it last? And the answer is nobody knows. But we on average say between 6 to 12 months. The next thing is, where the hell can I inject fillers? I mean, I've heard some crazy things. Can you really inject it in the clitoris? Yes, you can. You can inject. I know, I threw that out there like a shocker. So the most common, I'm just going to do the most common places that people inject, some of which you'll be like, oh yeah, I knew that. And some of you are going to be like, what? So you can inject the temples for hollow temples, the brows for hollow brows, the upper eyelid crease, because there's a hollowness that occurs in some people. The lower eyelid, there's a hollowness that occurs. The midface or the cheek. The jawline, the chin, and the angle of the jaw. Notice how I didn't say the nasolabial fold. That's the laugh line. I don't inject the laugh line. Go look at your kids. My 5-year-old niece has a laugh line. No one makes that go away. That looks crazy. So I don't inject it. Earlobes. People lose volume in their earlobes and they get deflated and dangly. Lips, noses. Well, it's called a liquid rhino. We can change the shape of your nose. It requires a great deal of skill, but can be done. Nipples. Some people have flat nipples and they want projection.
Okay, can you get back to the clitoris? I'm fast.
You have the G spot inside, and there's surgeons that make a living stating that it's, oh my God, this is, but I don't know if I buy that. I don't do that, but I'm just telling you what's being injected. I don't know that I agree. And the clitoris, there's people that lose volume in their labia and their clitoris, and you get, look, some people's vaginal vault, the vagina region, as they age, loses volume and it gets flat and hollow. You can inject labia outside, etc. Now, don't run out and do this. The point of the dialogue is that you can inject a lot of random places, more than your average places. Okay, so that's super, super, super important to understand. What we're going to do is we're actually going to take a quick break, and then when we come back, I'm going to talk about. Actually, you know what? I'm going to talk about it before we go to break, and then we'll come back. I just want to now talk about technique, because this is important. Unfortunately, you've never been injected by anybody else to know the variations. But a lot of patients come to me and they've been injected before, and then they get injected, and you kind of get a point of reference, and you kind of be like, oh wow, this is somewhat different. So there are 2 ways to inject people in general: using needles, the needle that actually comes with the syringe, or using something called a cannula, which is basically like a blunt, long instrument with a hole in one side. Wow, that sounds terrible. No, that's actually 10 times better. Needles are sharp and they are open at the end and they poke holes and they cause bruising. So needles create a lot, and they're short, so you can only inject a shortened distance. And that's what everyone is generally do, and they're I don't want to say trained, because I almost don't think anyone is trained anymore, but needles are what come in the boxes. Many years ago, I switched to cannulas. So a needle means, let's just say hypothetically we want to fill under your eye. Have we done that for you?
Yes.
Okay. So you inject under the eye. So it's a whole area that sweeps from the inner eye to the outer eye. So that area, if you inject with a 1 centimeter needle, you have to poke that long region at least 6 to 8 times. Every time you inject it, you have to leave a little lump of filler and then mash it down and try to create a smooth contour out of, it's creating trying to create asphalt out of cobblestones. You want a street that's smooth, but you're making it with bricks or cobblestones. There's no way it's going to be smooth. Furthermore, you're poking holes, painful, and you're getting through the skin and creating bleeding. Hence, you look like a raccoon, and it takes 2 to 3 weeks to recover. Is that what you've experienced?
No, my God. I walked out and 2 days later, everything was perfect.
Right. So when I started, I did it that way because that's what I knew. And I was getting, grief, swelling, lumpiness, bumpiness, bruising, patients calling back. I was like, screw this. Until I learned how to do cannula injections 10 plus years ago. And then my life changed, as did the patients. And I have patients like you where I inject, they go home, and then they go about their lives. Yeah. I can explain to you how we revolutionize. So what I do is I make a single poke in the cheek, 1 poke. And then I feather this long instrument from the cheek under the eyes, and I gradually and incrementally inject the area like putting on asphalt on a street. And you get a smoothness, you get almost no pain, you get almost no bruising because the item is, the cannula is blunt, meaning it pushes through the vessels, not pokes through the vessels. So you have very little bruising and then hence swelling.
Mm-hmm.
It is, I mean, revolutionized injections. And I do that cannula almost everywhere. Temples, upper eyelids, lower eyelids, mid-face, lips. There are very few places where I don't use the cannula. One of them would be the nose, just because you can't. And when I talk about risks, which of course, everything you need to understand risks, you'll understand what a revolutionized difference where it is with poking a needle, risk of blindness and necrosis versus a cannula, which has essentially no such risk. So technique is really important. And artistic know-how is important, but technique is probably by far the most important. So the difference between a needle and a cannula is the difference between cutting your hair with a clipper and cutting your hair with a pair of scissors. You just can't even compare. Now, you again have always had 99% of it with cannula, so you're like, wow, this sounds great. But it's miserable when you do it with needles. You should talk to your girlfriends.
Oh, no.
So we're going to take a quick break. We'll come back, and then I'm going to dive into just all the nastiness, the bad and the ugly of fillers, the people with horrible duck lips, et cetera, and we'll dive in together, okay?
Okay.
So let's join me after this quick break.
Okay.
Welcome back to Plastic Surgery Uncensored. Your host, Dr. Radir Ban. I'm here accompanied by my dear patient, Michelle, and we're diving in deep, and no pun intended, because she's a scuba diver, as am I, diving deep into fillers, what you need to know. So we kind of dabbled a little bit initially about how I do it, what you get, what kind of filler, et cetera. But I don't even think that's really the most important part. The most important part is the ugly side of fillers. And everybody knows the good side, but it's the ugly side that it needs to be discussed, because it's the ugly side that has hurt so many people, damaged our aesthetic, what we look at is appropriate and normal and whatnot, what's impacting young people, et cetera. So the first thing I want to talk about, the ugly side, is why is the idea of a filler automatically evoke a certain degree of like fear and a sort of a negative connotation? If I speak to a patient at a party who's never had filler, and I say the word filler, it's as if I said to her, poison, chemo, because immediately the visualization they have is this duct-filled, overfilled, crazy socialite gal that looks freakish, like she's got like lupus or something. Her face is swollen, and the crazy thing is they think they look good. That's what everyone thinks. And why is that? Because we've seen hundreds of these people, celebrities, online, at parties, at the library. We're inundated with them. Why? Is it the filler's fault? And listen carefully. You would never blame salt. If a recipe called for salt and your chef poured too much and the food tasted salty, you'd never walk away from a meal and be like, salt is terrible. God, I'm never cooking with salt again. You'd go, wow, this chef sucks. It's not salt's fault, nor is it the filler's fault. It's the idiot who injected you and over-injected you and allowed you to eat so many cookies that you feel nauseous. If your child reaches in the cookie jar and keeps eating cookies, and you as a parent don't say, hey, honey, listen, you've already had 4 cookies, then it's the parent's fault, not the child's fault. Who's the parent here? The injector. So if a patient walks out of your office and looks terrible, you should be ashamed of yourself. By terrible, I mean overfilled. You money-hungry, poorly trained individual, I can't tell you how ashamed of yourself you should be. So why does that happen? So what happened is you're getting overfilled. That's the problem, and it's gradual. Nobody just suddenly goes in. Nobody's not a strong word, but seldom do people come in and then walk out and they look like a freak. It's kind of like a slow, gradual process. You go in and put some filler in your lip and you get that little high. Your lips look fuller. You kind of like the way you look. And then you kind of look in the mirror and you're like, well, yeah, I don't know. I don't look. Then you go on Instagram and then all of a sudden your sense of self is tweaked and you go back. And then of course the person who's injecting you, who's not biased at all, not at all. Yeah, you could use another syringe. And then they inject you. And then over time, you just a slippery slope. Next thing you know, you don't even realize that you look like a weirdo. So the problem is that our sense of self, the end point, what we consider, wow, that's attractive, has so far been removed from where it used to be that everyone on social media, every woman as an anchor, everyone looks not normal. So then if you're a 20-year-old girl, you're going to think, well, like, yeah, my lips are good, but they're not that full. My cheeks are good, but they're not that full. And then you have these so-called influencers or random ass people that are just looking like, and then everyone's like, why does everyone look the same? Because at the end of the day, the distinctive parts of your anatomy, your eyebrows, your nose, your lips, when filled to the max, all look the same. So if you and I, both of us, look nothing alike, right?
Right.
Okay. I have an allergic reaction or I get stung by a bee and you get stung by a bee. My face swells up like a balloon. Your face swells up like a balloon. Do we look more alike as two balloons or more alike as regular individuals?
Yeah, more alike as two balloons for sure.
Right. You don't even have any distinctive features anymore.
Right.
Your lips kind of both look the same. Your face. So you're like, oh, is that a guy? So that's why everyone looks the same. Everyone's got high arch brows, sharp noses, super defined chins, super big cheeks, and everyone's slowly looking a little like a transgender person. Right? A trans, you know what I mean? Like half man, half woman.
That's right.
So that's the first thing. The reason that's occurring is because the individual who has access to the salt, the person making the meals, is very poorly trained. The worst thing that ever happened is the release of injectables into the commonplace world. I have no problem having someone who's trained do something. The problem is there is no regulation. How can a board-certified plastic surgeon, a family practitioner, a nurse injector, an interventional radiologist all be injecting you with Juvederm?
Oh my God. I didn't know that was possible.
Of course it's possible. Anyone can inject you with Juvederm. The PA can inject you. The physician assistant can inject you. Anyone can inject you as long as they have, as long as they have a license to take care of you. So nurses do, physician assistants do, there's no one that says that your pediatrician can inject your lips. They may not have a clue what you're doing, but they certainly can. So what's happened is you go online and you look at endless number of facilities and spas and whatnot. They're on Groupon and Guilt and all these things. And you're buying a commodity, you're buying the box. You're not buying the skill or the eye or the vision. It's convenience. I just go in and get it done. It's affordable and it's a pick-me-up and it makes me feel good and it's a girl thing to do with our friends. But let's be honest, the majority of people don't really look that good. And there's this critical point after which you don't look so good. Like the reason why, in my opinion, and perhaps you can attest to what your friends think, the reason why you look good is I only fill you to your normal youthful appearance. I don't overfill you. I bring you to neutral.
That's right. No, 100%. And it's just like, oh, you look like you're well rested. And you've even told me no.
Right. So what does that mean? I've told you no. Can you elaborate on that? What the hell does that mean?
Well, so I think maybe 6 months ago I came in and I was like, hey, I'm not sure. I can't tell. Maybe should we fill a little here and there? You're like, no, it's perfect the way it is. Like, don't touch it. It's not worth it. It's not,
Do you think I don't have a very expensive rent in Beverly Hills?
I know you do. But that's not how you work. And
what's another syringe? I'll just slip it in there. You'll never know the difference. It's nonsense. You don't need it. You will need it.
Eventually.
And so what happens is you have a natural tendency. Oh my God, I think it's disappearing. I think it's getting less. Oh my God. So you are that child reaching for the cookie. I am your parent. I am your advocate. I am your specialist. I am your cosmetic guru. It is my responsibility to go, Michelle, you look beautiful, honey. Just wait let's wait 3, 4, 5 more months. And you go, okay.
Yeah.
But I can feed into your fear and I can feed into your uncertainty and I can make much more money. And you can see how this is a perfect setup for what? A ton of overfilled, frozen, weird looking people.
Yeah. You have to care enough about the patient to say no. Just like you have to care enough.
Sometimes it's not even from they may just think that looks good. I mean, that's the crazy part. Sometimes they actually go like, you look better this way. Remember, at the end of the day, this is aesthetic, right? Who's to say that your lips being 3 times larger than they are isn't pretty?
That's true.
I'm no expert, but we kind of know when you start looking bizarre.
Yeah.
You know what I mean? So that's up to you. So now, okay, what's the danger? Who cares? Okay, so what? I look like I look like a cat woman. What's the big deal? Not honestly, that's not the concern. I mean, if you look weird and you know you look weird and you're happy, hey, kudos to you. I'm not going to tell you if you want to shave your head and color your hair green, knock yourself out.
Right.
The risks are, what are the risks? So number one is necrosis. What the hell is that? It means I inject you, and then the area that I inject you, the skin around it dies. That can happen from filler. Absolutely. Google it. You will see some shocking images. I'm injecting you predominantly, it occurs with needles. I'm injecting you, I push the filler into a vessel. That vessel then blocks the blood supply to, let's say, the corner of your nose. And then over the next 12 to 24 hours, the corner of your nose, your nostril turns black and dies.
Jesus.
Holy crap. Go online. After you get off the podcast, Google
Scare me.
necrosis. That'll be all you need to see. Okay, what about blindness? Blindness? What are you talking about? You can go blind. I can push filler, again, usually with needles, not so much with cannulas, around the nose and around the eyes. And as I push the filler, it can go into an artery, go up into your vein, into your optic vessel, and then plug the artery that leads to your eye and then cause blindness.
Jesus
You can go blind from filler. You go in, everything's hunky-dory, and then you go blind. Now, is that common? Of course not. It's not common, but it isn't not possible. Right?
Well, let me ask you, it's skill-based, right? So because
it's skill-based, it's knowing your anatomy, knowing where those vessels lie, knowing the technique in which how much pressure you put in, not overfilling someone. That's why I use a cannula. I don't think there's ever been a reported case of blindness from the cannula because of the way that it's designed. It's 100 things. But so if the worst that can happen to me is I don't look so pretty, then I don't really care if I go to a spa. I mean, it's not a big deal. If the worst that can happen to me is I go blind or my nose falls off, well, then damn well I'm going to wait an extra hour or pay an extra $100 or be inconvenienced and go to someone that arguably maybe is better trained. Again, the issue is not when everything is good. The issue is when the shit hits the fan. Everyone is good at what they do till the problem occurs. Then you need the expertise. You don't need the expertise at the beginning. Right?
Right. That's terrifying. Nobody knows that though.
Well, that's the thing. And the last thing is what's called a foreign body reaction, which is your body, you put this material in, it's technically not alive, and then you get infections or granulomas, and your body sees it as, and you can get an infection from filler because your body sees it as, and of course this is 10 times worse if it's a permanent filler, but your body sees it as a foreign material and it can create a reaction. And if it's very superficial, meaning very high up, it creates all kinds of lumps and bumps and inflammations and things of that nature. So I keep stressing it over and over again. People sometimes come to my office and they're annoyed. And they're annoyed that they waited an hour and a half. They're annoyed that, of course, it's going to be a bit more expensive. But they have traditionally walked away unscathed. And until something goes wrong, until you have a bad outcome, until someone says to you, hey, you know, you gotta check yourself, then you don't know any better. Again, I'm not knocking people who are nurse injectors or non-plastic surgeons. Knock yourself out. If you are trained and you feel highly skilled, by all means. Again, I'm here to just give the information to be careful. Filler has now become very much like getting nail polish. It has lost you've lost your fear. The minute you get into a cage with a lion and you think it's a kitty cat is the minute it takes your head off.
Right.
It's still a lion. It's still a lion. And so filler still has its dangers, and just be cautious and make sure that you don't just look at it as only positive, but make sure you recognize it for its healthy fear base. I think we really hit some of the real key elements. Is there anything in particular as a patient, now that you never did it, you've been doing it, you've seen friends that do it, what advice is there anything you would share or impart to people that are doing it or thinking of doing it that you think is really important?
I would tell them to come see you for sure, because I don't want to.
There's a lot of good injectors throughout the country.
I'm sure there are, but you want to find somebody that, I mean, it's your face. You need to know all the dangers. You need to have your own health assessment. You also need to be prepared. I think mentally going into it, I just trusted you. I wasn't scared. I just said, because you and I have a rapport and I trust you. I know your skill set. I know you're a master at what you do. And so I had this innate trust for you. So I was like, do whatever you think is best. I wouldn't do that just with anybody. But I wouldn't go to just anybody to get my fillers either. I want the best of the best. You know, I want an expert. I want somebody who knows. And also it's really important to me to look natural. And I just wanted a little bit of updating. You know, I just wanted a little bit of what time had done to me, and what I had gone through stressfully over 10 years of time with my husband leaving the earth was starting to show. And so he just kind of gave me a little reboot. And I love it. I don't even think about it. It doesn't enter my mind. You know, I would recommend everybody go see 1 or 2 or 3 different people. And it's not one of those things you just go, oh, hey, how much can I get for this amount of money? It's your face, it's your health. So
yeah, I mean, I think that the key is to recognize that Botox, filler, these are amazing tools, much like salt is an amazing ingredient.
Yeah.
When correctly utilized in the correct recipe by the right chef, you can create a delicacy beyond your imagination.
Yeah.
That being said, the overuse of even the greatest of items like salt can lead to terrible taste and perhaps even making you sick. And so all you have to do is recognize that the material is not ubiquitously safe, and that all injectors are not created equally. And just because you see a bunch of images online that show really pretty faces, again, when it matters about training is when something goes wrong.
That's right.
Until then, everyone seems to be created equal. And I would leave you with that, right? The question is, if something were to go wrong, we hope it never does, are you in a good place? Are you surrounded by someone who will be able to manage that complication? So it's been a pleasure having you. Thank you for coming and having this conversation with us. I think it's an important conversation. You can never have it too many times, and we'll continue to have conversations on filler over and over again, because it's like, I mean, it's literally become almost a normal part of our cosmetic world today. Yeah. And you're awesome. Rock on.
Thank you. Thanks for having me.
I want to go scuba diving with you, so don't forget about me.
I'm going to email you about scuba diving for sure.
I love it. All right, guys, that's another episode of Plastic Surgery Uncensored. Please join me next week, as I'm sure whatever we're talking about is going to be equally exciting. Thank you.